Well, Democrats might have some leverage in this fight. A poll from the Washington Post shows that 71% of Americans support extending the health care subsidies, which Democrats are fighting for in the current budget showdown. That money allows many low and middle income Americans to afford coverage. If those subsidies expire, nearly 4 million more people will be uninsured in 2034. That's per the Congressional Budget Office. Democratic leaders say this issue needs to be addressed immediately, while Republican Speaker Mike Johnson accuses Democrats of prioritizing illegal immigrants.
They have made a decision that they would rather give taxpayer-funded benefits to illegal aliens than to keep the doors open for the American people, to keep vital services, veteran services, health care and nutrition for women, infants, and children. They would rather not pay the troops and TSA agents and Border Patrol agents. They would rather stop services of FEMA in the middle of a hurricane season than to do the right thing.
Julie Rovner is the chief Washington correspondent for KFF Health News. So, Julie, this has become the favorite Republican talking point here. I think in part because Republicans know that Medicaid and these ACA subsidies are actually quite popular across the political spectrum. So they're claiming this is all about free health care for illegal immigrants. Can you fact check that point briefly for us?
Yes. It is not all about free health care for illegal immigrants. Democrats have two main asks. One is to renew these expiring tax credits, which the Republicans could have done in their big budget bill, but didn't do. And now open enrollment starts in less than a month, and people are going to start seeing these enormous premium increases, most of the people who get their coverage through the Affordable Care Act. The other big ask by the Democrats is to restore the Medicaid cuts from the big budget bill. And most of those cuts that had to do with people who are not citizens had to do with cutting off people who are here legally from eligibility for benefits. People who are here illegally have never been eligible for benefits, with one extremely small exception, and that is hospitals can get reimbursed for providing emergency care to people who, but for their immigration status, would have been eligible for Medicaid. So low-income people who are not here with documentation. What the bill did is it just cut the reimbursement actually to the state. So one would presume in turn the state will cut it to the hospitals. But it didn't even get rid of that program. So Republicans are really not correct in any sense of the word when they say that what Democrats are asking for would provide new eligibility for people who are not here legally.
When you look at the polling, majority of Americans, large majorities, favor extending the ACA or Obamacare tax credits and also hold favorable views of Medicaid. It's interesting when you dive deeper into the polling, both for voters across the board, but also for Republican voters, most either personally have been covered by Medicaid or had family covered by Medicaid or a close friend. And that's part of the issue here is that, again, while they're often attacked by Republicans, you got a lot of public support. That, I imagine, is behind Democrats trying to make this the issue here.
Yeah, well, Democrats obviously, poll better on healthcare than they do on a lot of other issues, including immigration. But one of the ironies here is that since these tax credits were expanded during the pandemic, the rolls have doubled for people who buy their coverage under the Affordable Care Act. And most of those people who have joined since then are from red states. And many of them are small business owners or farmers or ranchers, largely Republican constituencies. There's now 24 million people who are getting their coverage through the Affordable Care Act. If these expanded subsidies go away, it's going to be disproportionately Republicans who are going to be affected by it.
Several Republicans expressed interest in extending the subsidies, including a group of GOP congressmen who proposed legislation to do so last month. I suppose the question here, for both parties, right, will moderate Democrats peel off and say, hey, the shutdown is too costly politically, or might there be GOP politicians who say, actually, health care is a tough issue for us, too. Maybe we can make a deal. I mean, you cover this issue very closely. Do you see the ingredients for that meeting of the minds?
It's hard to tell. I mean, everybody saw this shutdown coming. We saw it coming from the beginning of the year. We were all a little surprised it didn't happen in March. So I don't think anybody's surprised about that. And we knew that these additional subsidies were going to be a pivot point for both parties. Who gives in? I think that depends on how it plays and how much attention people pay to it.
How about impact then before we go? If this funding does go away, if Republicans hold the line, how many people will be affected?
Well, as I said, my colleagues here at KFF have done a new analysis, found that on average, premiums will double for those 24 million people who buy their own coverage, or I guess 90% of them who get subsidies. Premiums could double on average. For some people, it will be much less. For some people, it will be much more. That's a pretty big hit. It's in all 50 states. People are going to start finding out about this pretty soon. Open enrollment begins November 1st. And then, of course, if people drop their coverage, it won't just affect the people who don't have coverage anymore. It's going to affect everybody else who has insurance, who wants to go to a hospital that may not be able to keep its doors open, or wants to go to a doctor who may have to raise prices because now they have so many non-paying customers.
Yeah. And people feel those impacts when it impacts their health. Julie Rovner, thanks so much for joining.